Welcome site! Welcome to another video for our pharmacology class. Today we are going to talk about a new drug which is yours truly, Sinutab. So grab some snacks and enjoy the video. Hello everyone, I am Sinutab. My generic name is acetaminophen, chlorpheniramine, and pseudoephedrine. But I also have many brand names such as the following. Lastly, my chemical name is chlorpheniramine plus pseudoephedrine plus acetaminophen. Now that you know who I am, let us move on to my drug classifications. My therapeutic classifications are decongestant, antihistamine, and analgesic, while my pharmacologic classification is sympathomimetic. Let us proceed to my pregnancy category. My pregnancy category is category N or is not categorized. However, my components belong to pregnancy category B. Now let us move on to my mechanism of action. My acetaminophen component acts as an antipyretics and analgesia by inhibiting prostaglandin synthesis, mainly in the CNS, that acts as mediators of pain and fever. On the other hand, my chlorpheniramine component antagonizes the effects of histamine at H2 receptor sites. It does not bind to or inactivate histamine. Thereby, it decreases symptoms of histamine excess such as sneezing, rhinorrhea, nasal ocular pruritus, ocular tearing, and redness. While my pseudoephedrine component stimulates alpha and beta adrenergic receptors and thus produces vasoconstriction in the respiratory tract mucosa and possibly bronchodilation. Thereby, it reduces nasal congestion, hyperemia, and swelling in the nasal passages. Okay, before we proceed, are you guys still with me? I hope you are because it's getting more exciting. Now let us talk about my pharmacokinetics. I am widely absorbed after oral administration in the gastrointestinal tract. I am also well distributed. My acetaminophen component is widely distributed as it crosses the placenta and enters the breast milk in low concentrations. While my chlorpheniramine component is also widely distributed with minimal amount excreted in the breast milk, it can also cross the blood-brain barrier. While my pseudoephedrine component appears to enter the CSF and probably crosses the placenta and enters breast milk. In addition, I am generally metabolized in the liver. My acetaminophen is 85 to 95% metabolized in the liver. Its metabolites may be toxic in overdose situations. While my chlorpheniramine is extensively metabolized in the liver, and my pseudoephedrine is partially metabolized in the liver. Finally, I am generally administered orally and excreted from the body by the kidneys in urine. Alright, you know a lot about me now, but there are still more important things you need to know about me. Do you know who should take me and what my indications are? I am indicated to temporarily treat the symptoms of colds, flu, allergies, and sinusitis. This is because as a decongestant, I help relieve stuffy nose, sinus, and ear congestion symptoms. And because I have acetaminophen, I can relieve pain and reduce fever. Also, as an antihistamine, I also help relieve watery eyes, itchy eyes, nose or throat, and runny nose and sneezing. However, you must be careful in taking me because I also have some important contraindications. I am contraindicated for people with hypersensitivity to me or other sympathomimetics or my other ingredients. I am also contraindicated to alcohol intolerance, hypertension, severe renal impairment, severe coronary artery disease, and children younger than age of 12. Yay! We're almost done! Now I am going to tell you my side and adverse effects in each body systems. In the nervous system, my side effects are headache, dizziness, and somnolence. For the cardiovascular system, my adverse effects are tachycardia, dysrhythmias, and myocardial infarction. While For the gastrointestinal system, my side effects include vomiting, abdominal pain, and diarrhea. For the integumentary system, my side effects are rashes, pruritus, and urticaria, while my side effects in the urinary system are dysuria and urinary retention. And finally, for the immune system, my side effect is hypersensitivity. Okay, my future nurses, we're almost done. I just have to tell you your responsibilities to your future patients when you see me before, during, and after my administration. Before my administration, assess for my mentioned cautions and contraindications, monitor the vital signs of your patient, and assess their neurologic and cardiovascular status. During my administration, always read the package label and take note of important details such as route of administration, dosage, and expiration date. Also, please do store me properly. Keep me in the original pack until it is time to take me. Keep me in a cool, dry place where the temperature stays below 30 degrees Celsius. Do not store me in the bathroom or near a sink. Heat and dampness can destroy some medicines, such as myself. Also, keep me out of reach of children. Next, follow the proper dosage recommended in administering me. My dosage is based on the age, medical condition, and response to treatment of your future patients. Do not increase my dose, take me more frequently, or use me for a longer time than directed. And always follow the doctor's order when you consume food along with me. Finally, after administration, monitor your patient's response to the drug therapy, such as symptomatic relief of colds and flu, including headache, sore throat, body ache, fever, and pain. Also, monitor the response, such as reduction of sinus pain, sinusitis, and sinus pressure. And don't forget to always keep monitoring for my side and adverse effects. Yay! Now you fully know who I am and what I am. I hope you learned a lot about me and enjoyed knowing me. It was fun knowing you too, my future nurses. Until next time, I hope to see you again in our next pharmacology class.